I am with one of my favorite people, Dr. Rakesh Patel, radiation oncologist, Good Samaritan in California. But what would you tell, or have you told, and I'm sure you have had discussions with your fellow radiation oncologists about Decision RT?
You know, Decision RT is exciting because it's the first time that we also got to play as local regional treaters in the biologically driven space. Medical oncologists have been doing it for years. You know, they have a cool test that looks at the DNA signature to tell you whether you escalate or de-escalate therapy. And we just kind of sit by and just radiate everyone. It's kind of boring because we're doing targeted therapy, but not really personalized or precision therapy. And so for me, I feel like, we have to keep up and modernize our treatment, and this allows us to do that.
So, but what is it like for you when literally the data shows that someone really would not benefit from radiation? What's it like delivering that kind of message?
Oh, it's one of my favorite days to be able to tailor treatment and not to over-treat. I mean, there's not a long line of people waiting for free radiation. It's not the word that conjures, yay, radiation, right?
It's scary.
So, but for me, this is treating appropriately, and sometimes just as many patients that we may not radiate, we end up opting in because they're biologically higher risk. And so it's not about de-escalating or removing radiation, it's about giving the right treatment at the right time to the right patient. And so for me, whether it's getting to confidently de-escalate or defer a portion of treatment, or whether we need to kind of, treat a little bit more aggressively, that's what I live for. I mean, that's what patients deserve and that's what they ask for.
But what about some radiation oncologists who really push back? Maybe they've been doing things a certain way for a long time, or they were really not interested in having this tool at their disposal.
Yeah, I mean, I think that's partially true because radiation oncologists generally are guideline driven. And so there are a lot of gatekeepers in medicine. We like to talk about the payers, things have to be covered. But I think physicians are gatekeepers. Physicians are all products of their training and are victims of our own biases. Radiation oncologists are generally pretty conservative when they're kind of changing paradigm. And the thing is, you can always find data to justify your bias. And there's data either way. And so radiation oncologists generally will err on the side of being conservative. And they call conservative, treat everybody, right? And for me, that's not being conservative, that's actually being aggressive when you're treating patients that may not actually benefit from it. So I think a lot of radiation oncologists are kind of stuck in their ways and kind of based on the trials they grew up on and haven't kept up.
So, I mean, what would you tell someone? Let's say you're having a conversation with a colleague who is resisting using a tool like a Decision RT. Like, what do you say to them?
Yeah, I mean, I tell them that we don't treat cancers, we treat patients. And in this case, we treat women. And if you're a person where we have information about the tumor, we talk about shared decision making all the time, yet we don't always provide all the information to the person that we're sharing that decision with. And so I would say that it's not okay not to use all the tools that you have available to make a smart decision. And so for me, it doesn't mean that you have to treat or don't have to treat, but not knowing is not a good excuse anymore. Even the data that suggests that we need to treat everyone is like pre-internet medicine. It's 9804. That's before the internet came out. And so for me, using data like that just, doesn't make sense, and I think it's inappropriate.
Do you find that when you meet with your patients who have had the Decision RT and you're kind of laying out the results, do you find that it's pretty easily understandable for them?
Oh, totally. So, it's actually not only easy to understand for them, it's easy to understand for me. And if I'm honest, like these reports, and the field has changed dramatically, which is great for patients. We have stage 4 patients that are now getting negative PET scans and living a long time. We have stage 0 patients, of course, that we're able to give less treatment and have excellent cure rates. But the reports are hard to keep up with. The data's hard to keep up with as a provider. And so having a report that you can actually use as a clinical decision support teaching aid, I print out that report and I walk in with it and we show patients what does it look like if you do surgery alone, and then how does it change if you give radiation. In some cases, there's a dramatic difference. These are the elevated risk patients. Sometimes they line up right on top and you can show that, it's okay to not radiate. And I think an important point I want to bring up is that not all patients are looking to avoid radiation. There's also anxiety in oncology about deferring treatment. We try to overtreat as few as possible, but by first principle, we undertreat nobody. And if you take that mindset, you end up overtreating a lot of patients.
Right.
And so the principle there is that showing a report when you're low risk that it's going to be okay if you don't radiate actually reassures a lot of especially younger women who are kind of reluctant about not radiating.
Yeah, because I think, and some people want to just go all the way to, I just want a double mastectomy, right? Like just get rid of everything, you know what I mean? But I think that having something like Decision RT, at least it gives you like a step, right, in that decision-making process, right? You can walk that back a little bit and say, here's the information that's available, correct?
100%. And it's one of the reasons I chair the high-risk tumor board. So we rally all the different disciplines every week. We go with the pathology, the imaging, the goals of the patient, their age, their medical condition. And we like to have this information at the time of core biopsy. The moment that the woman knows and she's thinking about all these things and the reflex is just remove it, thinking about everyone, like a woman does, everyone around her. I actually think that having that information up front can be very impactful for not just radiation decision, but also for what type of surgery you have.
Right.
Because you're thinking about the entire journey of treatment at that point.
Right.
And having that information prior to surgery can absolutely inform whether you do a mastectomy or not.
Yeah, and for me, I had it, after surgery, I had the test done, and there was a lot, definitely a waiting period of, okay, what's next?
Right, right, and that's the hard part.
I had the surgery, but, might not be done here, and so there's a lot of anxiety and uncertainty, I think, associated with that.
Yes. And a lot of information, right?
Yeah.
We don't have I don't think individuals have a data problem anymore. I mean, I have an Oura Ring, an Apple Watch, and my doctor tells me one thing, my family tells me another thing, my wife tells me another thing.
ChatGPT tells me something.
GPT doctors. And so you're going to cheat on someone.
Yeah.
And so who is it?
Yeah.
And so what individuals need is expert guidance, they need real-world experience, and they want to make smart decisions. Real information that's easy to digest and is actionable immediately. And that's where I think the report does the heavy lifting.
Right.
And I think that's what really helps me as a provider. It generates trust with the patient, and now the patient feels empowered to make a decision that that they understand.
I agree that it generates trust because I think that for the patient, it sends a message that you as a doctor are going to give them every available, like the very latest, what is all the available information, what is all the technology, like I am going to give you as much really truly understandable information. Like it's very easy to digest. And so, once you kind of can show your patient like that you care about them to that extent that you're gonna like run out every single ground ball, right? Like there is a trust factor that's built.
Yeah.
I think going the other way.
I think absolutely, and really at the end of the day, I used to in my early career, when a newly diagnosed patient came in, I felt the stress about imparting everything I knew. And now, as I get into like that second decade of my career and then now the third, the first thing I do when I walk in is saying, how are you holding up with all of this? And I start with the level of understanding that the individual has. And they may have heard the information 3 times, but they never really understood it because a lot of the system talks past them and just showers them with data versus information.
Yeah.
And I think partnering and making the decisions, prioritizing the things of what matters to that individual and her family, I think is very, very important. And candidly, looking more than traditional factors makes me look good. I mean, I'm keeping up. I'm modernized, right? I'm a precision medicine treater.
That's
so for me, it's been a great way of showing that I'm an advanced thinker.
Yeah, and it's an important part of communication, right?
Sure.
Like, it's a tool.
It is.
A communication tool, as well as like a game plan tool.
Yes, right. It's a playbook.
One word you would use to describe the impact of Decision RT?
I would say empowering. I think by now you've heard a lot of people say the usual suspects of precision, clarity, personalized, but I haven't been sitting here, but I'm guessing.
Game changer.
Game changer. Right. I love all these metaphors. Hail Mary, like touchdown Jesus. But no, I think generally what I would say is that individuals finally understand what causes the tumor to tick and when there is a value in how aggressive to treat. To me, it's not just a radiation or no radiation. It's about on the elevator of how much radiation, how do you treat, should I have hormonal therapy, what kind of surgery, and I finally understand how worried I should be. So to me, creating agency in the woman, it's empowerment, I think that goes a long way regardless of the outcome.
Because when you first hear that you've been diagnosed, you do feel powerless.
Yeah.
Right? And
Yeah.
so I think any notion of power, agency, knowledge, and all of that, you literally get a lot of yourself back.
Yeah.
And you get that sense of control back. And
Right.
you know you can't control the uncontrollables, but to the extent that you feel that you're able to do something and that you're a partner in those decisions is really important.
It
Yeah.
matters.
Yeah.
It's why we do what we do.
Yeah. Awesome. Thank you so much.
Yeah, it's great talking to you.